I'm going to spend a few minutes talking about the Affordable Care Act. And I wonder how many people on the Republican side today are going to talk about Obamacare. If they do, they should be in a very, very positive state. We know that as a result of this bill, this Affordable Care Act, people are getting, and soon will get, everyone will get a rebate. One of the things we did, led by Senator Franken and others, is that 80% of the money that is paid for premiums has to go to patient care. And if it isn't, the amount that doesn't has to be refunded to the patients. And that's in the process now. In the month of August, all those monies will come back, yes, in a significant amount to Americans who have, in effect, have they're part of programs that spend too much time on salaries for bosses. Also, we're going to talk a little bit today about what this does, this Affordable Care Act, for women in America today. As I said, I'm going to speak very briefly on this, but we're going to have people come today as soon as I finish, and as soon as the Republican leader finishes, to talk about the good things in this bill for women, and I'll just touch on them just very briefly. There's no question that this bill, signed by President Obama, is landmark. It's a landmark piece of legislation. It signaled an end to insurance company discrimination among many, but especially against those who are ill, against those with pre-existing conditions, and especially, Mr. President, against women. As a result of this bill we passed, being a woman is no longer a pre-existing disability in America. For many, many years, insurance companies have charged American women higher premiums. Why? Because they're women. And for years, American women have unfairly borne the burden of high cost of contraception as well. Even women with private insurance often wind up spending hundreds of dollars each year more for birth control. Today, women of reproductive age spend 2/3 more out of their own pockets for health care costs than men, largely due to the high cost of birth control. But starting tomorrow, Wednesday of this week, new insurance plans must cover contraception and many other preventive health services for women. How much, Mr. President? No additional pay at all. Under health reform, about 47 million women, including almost 400,000 women in Nevada, will have guaranteed access to those additional preventive services without cost sharing. Many on the other side have downplayed the importance of these benefits or fought to repeal them altogether. Hard to comprehend, but true. Forcing American women to continue struggling with the high price of contraception has very real consequences. Every year, millions of women in the United States put off doctor's visits because they can't afford the copays. And millions more skip pills or shots to save money. And it's no mystery why the United States has one of the highest rates of unintended pregnancies among industrialized nations. Half of all pregnancies in America are unplanned. And of those unintended pregnancies, about half wind up in abortion. Increasing access to contraception is the most effective way to reduce unintended pregnancies and to reduce the number of abortions. But the high cost is often a barrier. That's why in 1997, Olympia Snowe and I began a bipartisan effort to prevent unintended pregnancies by expanding access to contraception. It hasn't been an easy path. It wasn't then, but we did make a start. As part of this effort, we helped pass a law ensuring federal employees access to contraception. I'm sorry about that, Mr. President. And it was a big, big issue. That was 15 years ago or more. It's an issue that is still important, but we started it, and I'm very happy about that. Olympia Snowe was terrific to work with. When this benefit took place in 1999, premiums did not go up a single dime because neither health care or did the health care cost, not a penny. It was rewarding to know that a pro-life Democrat and a pro-choice Republican were able to confront the issue with a practical eye rather than a political eye. It's unfortunate that over the last 15 years, an idea that started as a common ground proposal has become so polarizing here in Congress. The controversy is really quite strange when you consider that almost 99% of women have relied on contraception at some point in their lives, and many have struggled to afford it. Mr. President, 99%. The Affordable Care Act will ensure insurance companies treat women fairly and treat birth control like any other preventive service. Prior to Senator Snowe and I doing this, you know, Mr. President, anything that a man wanted, they got. Viagra, fine, we'll take care of that. Anything a man wanted, they got, but not a woman. But the law doesn't just guarantee women's access to contraception. It assures our access to many other life-saving procedures as well. Thanks to the health care bill, Affordable Care Act, insurance companies are already required to cover preventive care like mammograms. Mr. President, a person that is able to have a mammogram is life-saving. Most people in the Senate know that my wife has had battling breast cancer. Mr. President, she had a mammogram in December, and in August discovered a lump in her breast. And think what would have happened if she had waited a year, because she couldn't afford that mammogram. Frankly, the thought of it is very hard for me to comprehend, because even though she had that mammogram in December, she found she was in stage 3 of breast cancer, and it's been very difficult. But what if she had waited an extra year? Many people wait a lot longer than an extra year. Colonoscopies. So I was talking to one of my friends in the Senate. You know, these colonoscopies save lives. He's going to have his done, and do it every 5 years. It takes about 10 years for these polyps to develop cancer, but they all develop cancer if you don't take them out. People need to have these done. Blood pressure checks, childhood immunizations without cost sharing. That's part of what's in this bill. Used to be a bill, now it's a law. Starting tomorrow, again, Wednesday of this week, women will no longer have to reach into their pockets to pay for wellness checkups. They can do screening for diabetes, HPV testing, sexually transmitted infection counseling, HIV screening and counseling, breastfeeding support, or domestic violence screening and counseling. That's all in the law today, starting tomorrow. And all women in new insurance plans will have access to all forms of FDA-approved contraception without having to shell out more money on top of their premiums. Ending insurance company discrimination will help millions more women afford the care they need when they need it. And it will restore basic fairness to the healthcare system. Sometimes the practical thing to do is the right thing to do. And that's what the legislation that we work so hard to pass is all about. It's about doing the right thing for everyone. But today we're going to focus on women.